Okay, so now we've done our 4-week appointment. What are the next appointments coming up?
Okay, then we need to check at the 4th month, like 3 or 4 months late after the surgery. We need to check the osseointegration of the implants clinically. Okay, we take x-rays again. We remove your prosthesis because at that point we're able to touch everything. It's supposed should be. If an implant is not osseointegrated at that point, it's not going to osseointegrate. You may have less bone around the implant sometimes, and we, depending on the patient, we wait a little bit longer. Okay, but usually at that point should be everything osseointegrated. So we just remove the denture, we check the implants, we check the soft tissue, everything is healthy. We proceed to make a final impression. Okay, final impression. Why? Because we already have an impression where we did your temps, but we do a final impression with the position of the soft tissue, where it is, everything is already healed, contours, everything. Okay, so at that point we do final impression records, and depending on this temp, for example, imagine that you say, no, I don't like this front teeth. So we do the changes that we need, and we proceed with another PMMA. Okay. So we do what we call.
That's if there's something after the 4 months that I keep looking in the mirror and I'm like,
Exactly.
I don't like that. You're going, all right, we've gotten all the clinical pieces out of the way. Now we're going to the aesthetic side of things, and we're going to make you another temp based on our conversation, which will then, that would be that point where you would put a new.
We call it the trial PMMA. Okay, that actually we do it with 99% of the patients. Why? Because sometimes we don't load all the implants. Sometimes we load only the 4 anterior implants, for example. So everything looks great, but we need to do the trial PMMA to the final contour of the final prosthesis. So we'll get to the last implants. Okay, for example. Okay.
Because you guys didn't load, that's why.
Sometimes we don't load the most posterior implant, or maybe one of the implants you did a lot of grafting. So we keep that implant without any loading during the healing process. So yes, we need the trial PMMA. Okay? So in your case, we load all of them. So in your case, it's maybe easier because if you like this, we just proceed to the final. Okay? If we need to do changes, we do the trial PMMA, and you try it for a couple of weeks.
Okay.
To see if you're not biting your cheeks, to see if your speech is good, everything is good. Maybe you say, no, I don't like the gum shape, or I don't like the incisal edge of these, whatever. Okay, so we do those changes in the PMMA before we go to the finals. Once you accept that one, everything is good, you try it, your family approve it, we just move to the final one. Because once we do the final, we cannot do any changes. Okay, so it's a very expensive change. We move forward.
That's right.
Because imagine.
Yeah.
Okay.
Yeah.